Greetings from CARE Fertility. If you're concerned about endometriosis and fertility, this video is for you. What is endometriosis? How do you diagnose it? What does it do to fertility? How do you treat it? Do you need an operation for endometriosis or should you have IVF? Let's answer these and other questions. What is endometriosis? Before learning about endometriosis, we need to know what endometrium is. Endometrium is the normal tissue that lines the womb cavity. So here is the womb, and this is the lining of the womb. When you have a period, this lining is shed into the vagina here. These are the fallopian tubes, and these are the ovaries shown in green. In women with endometriosis, the endometrium is also found outside of the womb cavity. So here I have shown you in red endometriotic spots in the pelvic cavity or in the abdominal cavity. It can also implant inside the ovary and cause a cyst, and that is called an endometrioma. Endometriosis causes inflammation and scarring. It can also distort or block the fallopian tube. How do you diagnose endometriosis? You need to look out for symptoms such as very heavy or painful periods, or pain before a period, or pain during intercourse. To make a firm diagnosis of endometriosis, you need an operation called laparoscopy. As for endometriotic cysts in the ovary, these can be picked up with an ultrasound scan. What does endometriosis do to fertility? Research evidence shows endometriosis reduces your fertility chances. We carried out a comprehensive analysis of data a few years ago. We found that endometriosis was associated with reduction in fertilization, implantation, and pregnancy rates. If we have endometriosis in the ovary, that may mean we gather fewer eggs during IVF treatment. How can we treat endometriosis? There is still much debate about how to treat endometriosis to improve fertility outcomes. The treatment will depend on the extent of the disease and the clinical history. If the endometriosis is mild, then surgery to remove the endometriosis is an option. It can improve natural pregnancy chances. If that does not work, most doctors will advise IUI or intrauterine insemination. Couples usually have 3 or 4 cycles of IUI treatment. If that does not work, then IVF treatment is often recommended. If a patient has moderate or severe endometriosis, then it may be reasonable to go straight to IVF treatment. There is some interesting data suggesting pre-treatment with a medicine called GnRH analog for 3 to 6 months before IVF can improve pregnancy chances. If a patient has endometrioma, that is the endometriotic cyst in the ovary, what we do often depends on the size of the cyst. Generally, if the cyst is more than 4 centimeters, many doctors will recommend a removal of it before you go through with IVF treatment. If the endometriotic cyst is less than 4 centimeters, patients can normally go ahead with IVF treatment without surgery first. These are the treatment principles for endometriosis. I hope you found this video useful. Look out for other videos on our channel. Cheerio!